Doctors are notoriously known as being the worst patients. Before we start, let me make it clear that this is no way meant to criticize any professional, but only to spread awareness so that doctors can take good care of their health too. This phenomenon can be attributed to several factors related to their medical training and profession. Firstly, doctors tend to have an overconfidence in their own health knowledge. After many years of intense medical education and clinical experience, doctors understandably gain a high level of confidence in their diagnostic and treatment abilities. However, this can lead them to minimize or ignore symptoms in themselves that they would find concerning in a patient. They may assume that they can self-diagnose and self-treat minor medical issues without needing to consult another physician. However, self-diagnosis, especially in one's own case, can be flawed and risky. Related to the overconfidence factor is that doctors often have difficulty switching from the role of caregiver to that of a patient. The doctor identity becomes strongly ingrained, and it can be challenging for doctors to relinquish control and put their health in the hands of another provider. They may resist the patient role because it undermines their self-image as the medical expert. Accustomed to directing their own health care, they may struggle to follow another physician's recommendations. Research shows that doctors self-report poor adherence to medical advice compared to non-medical patients. Doctors also tend to have minimized health symptoms and avoidance behaviors when it comes to their own health. One study found that physicians often ignore cardiac symptoms, self-medicate, and avoid seeking care. Reasons for this include denial, not wanting to lose time at work, and fear of medical procedures. Doctors are used to seeing extreme health cases on a regular basis, so they may subconsciously normalize and downplay their own symptoms. They may also minimize preventative care and health maintenance behaviors like health screenings, exams, and immunizations. This avoidance can lead to more advanced disease when untreated issues escalate. The medical profession promotes a culture of stoicism and invincibility when it comes to health. Doctors are expected to be strong, brave, and able to endure significant stress and physical demands. Admitting vulnerability by seeking medical care can feel stigmatizing. Doctors may feel embarrassed to become a patient themselves, as if it undermines their competency and professional standing. Consequently, doctors will often keep working even when unwell. A 2022 study found that 3 in 4 resident physicians continued working while sick instead of taking time off to recover. Finally, doctors' irregular and demanding work schedules can contribute to their poor self-care. Long erratic work hours leave little time for personal health needs, and constant pressure to put patients first may cause doctors to deprioritize their own well-being. Lack of sleep and limited ability to book health appointments because of inflexible schedules compromise doctors' ability to access health care for themselves. Some real-world examples illustrate how the above factors cause doctors to avoid necessary medical care. In 2021, a veteran ER doctor died by suicide during a major depressive episode without seeking psychiatric help. Colleagues attributed it to the culture of medical invincibility. A physician resisted seeing his doctor about severe shoulder pain for months, insisting it was just a muscle strain he could treat himself. It was finally diagnosed as a fast-growing bone cancer requiring urgent surgery and chemo. An internist fainted from heart arrhythmia and hit her head. She refused an ambulance and later drove herself to the hospital. She only told colleagues days later when concussion symptoms persisted. A surgeon scheduled an elective hip replacement for a patient, but postponed his own needed knee surgery for over a year due to being too busy. This led to worsening mobility. In summary, despite their medical expertise, doctors often fail to seek appropriate care for their own health problems. Causes include overconfidence in self-treatment, avoiding the patient role, stoicism, minimizing symptoms, irregular work schedules, and stigma against doctors becoming patients themselves. Recognition of these psychological and systemic factors can hopefully prompt change in medical culture to better promote physician well-being. With self-awareness and priority of personal health, doctors can avoid the pitfalls of becoming reluctant patients.